Thank you for making your first stop on this provider journey at the History of Developmental Disabilities Services in Ohio. When we learn about the history of where we came from and why things changed, we have a better understanding of why we do what we do today. In 1857, the first state-supported residential school opened in Ohio, around the time that training and boarding schools opened in the U.S. They were to provide education, employment, and a means to return people to society. Between 1850 and 1890, the number of individuals living in these settings jumped from 15,000 to 95,000. Early in the 1900s, segregation and institutionalization continued and increased through the 40s. Parents were still encouraged by their healthcare providers to place their child with DD in an institution. Most of these settings only provided necessities, and the conditions were deplorable. They lacked the appropriate ratio of staff to provide meaningful activities and to acquire basic skills to improve quality of life. Broadview Developmental Center was the first state institution for people with DD in Ohio. In 1967, Ohio County Boards of Mental Retardation were created to focus on local supports, education, and home support services. Because the members were family and family organizations, this enabled parents to keep children at home and be more involved in the delivery of services to their children. Sheltered workshops opened to transition students from school to vocational settings to learn life skills. In 1972, the Ohio Department of Mental Retardation and Developmental Disabilities was created to improve conditions in Ohio institutions and services. The Rehabilitation Act of 1973 addressed civil rights and the protection of persons with DD. They were empowered and encouraged to stand up for their rights. This began many changes that led to deinstitutionalization. State funding emerged to assist individuals to leave institutions and move into community-based residential settings. In 1986, the state separated the departments of mental retardation and mental health. In 1987, the Developmental Disabilities Awareness Month was established. In 1988, the Bill of Rights for Persons with Developmental Disabilities was included in Ohio law. Major additions to federal law, the Americans with Disabilities Act, ADA, and the Individuals with Disabilities Education Act, IDEA, were passed in 1990. In 1999, the Olmstead decision prohibited segregation of individuals and stated that individuals deserve fair housing and to live in the most integrated, least restrictive setting to receive services in the community. This led to the first Medicaid-funded waiver in Ohio to move from institutional settings into community residential settings. In 2007, Senate Bill 79 acknowledged that language was powerful and mental retardation was changed to developmental disabilities. Additional changes to Ohio law to remove negative words used to describe people with developmental changes were made in 2012. Also in 2012, Ohio became an employment-first state, emphasizing the importance of people with developmental disabilities participating in the workforce. In 2018, the Technology First Executive Order was signed and remote monitoring and assistive technology was made more accessible for people with developmental disabilities for them to live safely and independently. There have been many changes in Ohio's DD system throughout the years which have resulted in more opportunities for people with developmental disabilities to live, work, and play in their communities, supporting them to live their best lives.